Gray is a straight A student. He's in class with his twin brother.
He's caring. He's a sweet kid. Smart, funny, loves his family.
He plays basketball, soccer, baseball. He's on the swim team. He's doing everything that we were told probably wouldn't be happening. It was December 2016, and his eye would maybe kind of do a little funny twitch. He would kind of talk out of one side of his mouth, but we kind of chalked it up to him being 3. Within 2 weeks of it starting, we called the pediatrician, and he said, come in immediately. But we ended up having some pain, which caused us to go to Children's Hospital, where Gray had his very first MRI at 3 years old. And with that, our whole entire journey started. We had seen every single doctor at Children's. They couldn't figure out what was going on. He had lost ability on the left side of his body. He couldn't really walk anymore. He couldn't run anymore. He couldn't do stairs. We were at Children's 30 times a month. We were a mystery. No one could figure out what was going on, and then they decided that we needed to have a brain biopsy. They gave us the name of Rasmussen Encephalitis. One half of his hemisphere of his brain was sick and getting attacked by his immune system.
Rasmussen's encephalitis is a really rare disorder. It's not really clear what the cause of, but it results in inflammation on one half of the brain. Because of that, these children will eventually develop pretty intractable seizure disorder, and they may develop some motor dysfunction and have some significant difficulties in ambulation.
We started infusions at Children's Hospital, and we would come in every 3 weeks. The infusions were to get his immune system to kind of reset and come back to normal, and so it's not attacking his brain anymore. So in the summer of 2020, we found out that he was going into heart and lung failure. It happened within the same month that they've diagnosed him with a mitral valve regurgitation. He had open heart bypass surgery when he was 6. And when we came home from heart surgery, the whole entire neighborhood was flooded with yellow super gray signs in everyone's yard. The next course of action for Gray is we are in the Undiagnosed Disease Network through St. Louis Children's Hospital. That is due to all the extra things that we've had going on. Gray's had about 8 or 9 surgeries total, and they just want to make sure, do we have the correct diagnosis or do we have multiple diagnoses? Quinn was our introduction to the Joe Buck Center. Gray has surpassed him with the number of times, and I would say that Gray has probably had, I think 100 would be a ballpark number.
So the Joe Buck Imaging Center is really the premier imaging center within the St. Louis area. It is a complex of both conventional radiological services, but also has CT scanning and has state-of-the-art MRI. In fact, it's the only 3 Tesla, which is the size of the magnet that permits the highest resolution of those types of images.
The enhancements to the MRI suite and for the Joe Buck Imaging Center will directly affecting patient care. It will help improve the quality and standard of care for the patients. We will be able to have faster turnaround times, quieter scanners, and just more comforting for the patients.
When you first walk in, you're greeted with the enormous baseball bat. And as a mother of children who are obsessed with sports, that just puts everyone at ease. I would love every child that goes there to be able to flourish like we have been lucky to be able to do because of the imaging, because of the doctors, because of the way we've been treated and taken care of.
Personally, it's a rewarding experience, knowing that I'm the one that gets to help diagnose and be there for these patients in some of their most vulnerable times. Just remembering that you were that person there to help them through these times is probably the best part of being part of the Joe Buck Imaging Center.
They never made Gray feel that anything was wrong with him. They always treated all 3 of them exactly the same. It was pretty magical watching them all do everything together because it doesn't just affect Gray, it affects the whole entire family.
It's been wonderful. Great nurses, great doctors.
To the donors of St. Louis Children's Hospital, thank you so much for everything. It is unbelievable what the donations make you feel.
From the physicians and staff at St. Louis Children's Hospital, we can't thank you enough for supporting pediatric research and care at St. Louis Children's Hospital.
My wish for Gray, just have a good life.
My wish for Gray is that he gets to be everything that he wants to be. If he wants to be a sportscaster or a professional athlete, that he is able to do it, and that he always knows that he's got myself, Andrew, Quinn, and Sully by his side fighting with him the whole entire way that we always have been.